Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
The client with Alzheimer's disease may have delusions about being harmed by staff and others. When the client expresses fear of being harmed by staff, which of the following responses is most appropriate? 1. What makes you think we want to harm you? 2. We like you too much to want to harm you. 3. You are in the hospital. We are nurses trying to help you. 4. Oh, don't be so silly. No one wants to harm you here. The correct answer is 3. The nurse needs to present reality without arguing with the delusions. Therefore, stating that the client is in the hospital and the nurses are trying to help is most appropriate. The client doesn't recognize the delusion or why it exists. Telling the client that the staff likes him too much to want to harm him is inappropriate because the client believes the delusions and doesn't know that they are false beliefs. It also restates the word harm, which may reinforce the client's delusions. Telling the client not to be silly is condescending and disparaging and therefore inappropriate. A laboring client smiles pleasantly at the nurse when asked simple questions. The client speaks only Mandarin, and the interpreter is busy with an emergency situation. At her last vaginal examination, the client was 5 centimeters dilated, 100% effaced, and at 0 station. While working with this client, which of the following responses indicates that the client may be approaching birth? 1. The fetal monitor strip shows late decelerations. 2. The client begins to speak to her family in her native language. 3. The fetal monitor strip shows early decelerations. 4. The client's facial expressions become animated. The correct answer is 3. When the fetal head is compressed, early decelerations are seen as a vagal response occurs, and the fetal heart rate decelerates and inversely mirrors a contraction. This response commonly occurs when the client is 9 to 10 centimeters dilated or pushing. If communication cannot be facilitated, early decelerations are one indicator that birth may be approaching. Late decelerations may occur at this time, but indicate uteroplacental insufficiency rather than imminent birth. At any time during the labor process, the client may communicate with her family in her native language. The client's facial expressions may change at any point during labor and cannot be used as an indicator of imminent birth. While a client is being admitted to the birthing unit, she states, "My water broke last night, but my labor started 2 hours ago." Which of the following is concern? Select all that apply. 1. Maternal vital signs. Temperature, 99.5, heart rate, 80, respiration. 24, blood pressure 130/80. 2, blood and mucus on perineal pad. 3, baseline fetal heart rate of 140 with a range between 110 and 160 with contractions. 4, peripad stained with green fluid. 5, the client states, "This baby wants out. He keeps kicking me." The correct answers are 3, 4, and 5. The range of fetal heart rate fluctuating too high and low could indicate fetal distress. The green peripad fluid indicates meconium, which could be associated with fetal distress. Increased fetal activity during labor may also indicate distress. The maternal vital signs noted and a perineal pad with blood and mucus are normal findings. The stool culture of a child with profuse diarrhea reveals Salmonella bacilli. After teaching the mother about the course of Salmonella enteritidis, which of the following statements by the mother indicates effective teaching? 1. Some people become carriers and stay infectious for a long time. 2. After the acute stage passes, the organism is usually not present in the stool. 3. Although the organism may be alive indefinitely, in time it will be of no danger to anyone. 4. If my child continues to have the organism in the stool, an antitoxin can help destroy the organism. The correct answer is 1. After having S. Enteritidis. Some clients become chronic carriers of the causative organism and remain infectious for a long time as the organism continues to be shed from the body. During this time, the child is still considered infectious. No antitoxin is available to treat or prevent Salmonella infections. The nurse is showing the parent of a child with Hirschsprung's disease where the ganglionic area is located. Identify the area the nurse should point out as being a ganglionic. 1A, 2B, 3C, 4D. The correct answer is 4. In most instances, the absence of ganglionic innervation occurs in the lower portion of the sigmoid colon, just above the anus. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. To reduce the risk of dumping syndrome, the nurse should teach the client to do which of the following? 1. Sit upright for 30 minutes after meals. 2. Drink liquid with meals, avoiding caffeine. 3. Avoid milk and other dairy products. 4. Decrease the carbohydrate content of meals. The correct answer is 4. Carbohydrates are restricted, but protein, including meat and dairy products, is recommended because it is digested more slowly. Lying down for 30 minutes after meal is encouraged the slow movement of the food bolus. Fluids are restricted to reduce the bulk of food. There is no need to avoid caffeine. A client admitted to the hospital with peptic ulcer disease tells the nurse about having black, tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Black, tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digestate blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digestate blood. Until other information is available, it is not necessary to initiate contact precautions. When assessing an aggressive client, which of the following behaviors warrants the nurse's prompt reporting and use of safety precautions? 1. Crying when talking about his divorce. 2. Starting a petition to delay bedtime. 3. Declining attendance at a daily group therapy session. 4. Naming another client as his adversary. The correct answer is 4. The client exhibits aggression against his perceived adversary when he names another client as his adversary. The staff will need to watch him carefully for signs of impending violent behavior that may injure others. Cry about a divorce would be appropriate, not pathologic, behavior demonstrating grief over a loss. A petition to delay bedtime would be a positive, direct action aimed at a bothersome situation. Although declining to attend group therapy needs follow-up, there may be any number of unknown reasons for this action. The client with dementia states to the nurse, "I know you. You're Margaret, the girl who lives down the street from me." Which of the following responses by the nurse is most therapeutic? 1. Miss Jones, I'm Rachel, a nurse here at the hospital. 2. Now, Miss Jones, you know who I am. 3. Miss Jones, I told you already I'm Rachel and I don't live down the street. 4. I think you forgot that I'm Rachel, Miss Jones. The correct answer is 1. Because of the client's short-term memory impairment. The nurse gently corrects the client by stating her name and who she is. This approach decreases anxiety, embarrassment, and shame and maintains the client's self-esteem. Telling the client that she knows who the nurse is or that she forgot can elicit feelings of embarrassment and shame. Saying, "I told you already" sounds condescending, as if blaming the client for not remembering. A full-term client is admitted for induction of labor. When admitted, her cervix is 25/0. The initial goal is cervical ripening prior to labor induction. Which drug will prepare her cervix for induction? 1. Nalbuphine. 2. Oxytocin. 3. Dinoprostone. 4. Betamethasone. The correct answer is 3. cervical ripening, or creating a cervix that is soft, anterior, and dilated to 2 to 3 centimeters, must occur before the cervix can efface and dilate with oxytocin. Drugs that accomplish this goal include dinoprostol and misoprostol and prostaglandin E2. Nalbuphine is a narcotic analgesic used in early labor and has no influence on the cervix. Betamethasone is a corticosteroid given to mature fetal lungs. A multigravida laboring client has an extensive documented history of drug addiction. Her last reported usage was 5 hours ago. She is 2 centimeters dilated with contractions every 3 minutes of moderate intensity. The primary healthcare provider prescribes nalbuphine 15 milligrams slow IV push for pain relief followed by an epidural when the client is 4 centimeters dilated. Within 10 minutes of receiving the nalbuphine, the client states she thinks she is going to have her baby now. Of the following drugs available at the time of the birth, which should the nurse avoid using with this client in this situation? 1. 1% lidocaine. 2. Naloxone hydrochloride. 3. Local anesthetic. 4. Pudendal block. The correct answer is 2. Naloxone hydrochloride would not be used in a client who has a history of drug addiction. Narcan would abruptly withdraw this woman from the drug she is addicted to as well as the nalbuphine. The withdrawal would occur within a few minutes of injection and, if severe enough, could jeopardize the mother and fetus. Xylocaine is a local anesthetic and numbs rather than decreases the effects of Narcan. The local anesthetic and the pudendal block are both appropriate for this birth, but are used to numb the maternal perineum for birth. Which of the following will be the best activity for the nurse to include in the plan of care for an infant experiencing severe diarrhea? 1. Monitoring the total 8-hour formula intake. 2. Weighing the infant each day. 3. Checking the anterior fontanelle every shift. 4. Monitoring abdominal skin turgor every shift. The correct answer is 2. Because an infant experiencing severe diarrhea is at high risk for a fluid volume deficiency, the nurse needs to evaluate the infant's fluid balance status by weighing the infant at least every day. Body weight is the best indicator of hydration status because a higher proportion of an infant's body weight is water compared with an adult. Initially, the infant with severe diarrhea is not allowed liquids, but is given fluids intravenously. Therefore, monitoring the oral intake of formula is inappropriate. Although checking the anterior fontanelle for depression or bulging provides information about hydration status, this method is not considered the best indicator of the infant's fluid balance. Monitoring skin turgor can provide information about fluid volume status. The abdomen is commonly used to assess skin turgor in an infant because it is a large surface area and can be accessed quickly. However, weight is the best indicator of fluid balance. When assessing an infant with suspected inguinal hernia, which of the following findings will be most significant? 1. The inguinal swelling is reddened and the abdomen is distended. 2. The infant is irritable and a thickened spermatic cord is palpable. 3. The inguinal swelling can be reduced and the infant has a stool in a diaper. 4. The infant's diaper is wet with urine and the abdomen is non-tender. The correct answer is 1. Abdominal distension and a redness of the inguinal swelling are significant findings. Their presence in conjunction with area tenderness and inability to reduce the hernia indicate an incarcerated hernia. An incarcerated hernia can lead to strangulation, necrosis, and gangrene of the bowel. Other findings associated with strangulation include irritability, anorexia, and difficulty in defecation. Irritability is nonspecific and could be caused by various factors. A palpable, thickened spermatic cord on the affected side is diagnostic of inguinal hernia and would be an expected finding. A wet diaper indicates that urine is being excreted, a finding unrelated to inguinal hernia. Which of the following would be an expected outcome for a client with peptic ulcer disease? The client will 1. Demonstrate appropriate use of analgesics to control pain. 2. Explain the rationale for eliminating alcohol from the diet. 3. Verbalize the importance of monitoring hemoglobin and hematocrit every 3 months. 4. Eliminate engaging in contact sports. The correct answer is 2. Alcohol is a gastric irritant that should be eliminated from the intake of the client with peptic ulcer disease. Analgesics are not used to control ulcer pain. Many analgesics are gastric irritants. The client's hemoglobin and hematocrit typically do not need to be monitored every 3 months unless gastrointestinal bleeding is suspected. The client can maintain an active lifestyle and does not need to eliminate contact sports as long as they are not stress-inducing. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following is a priority to include in the plan of care for a client with Alzheimer's disease who is experiencing difficulty processing and completing complex tasks? 1. Repeating the directions until the client follows them. 2. Asking the client to do one step of the task at a time. 3. Demonstrating for the client how to do the task. 4. Maintaining routine and structure for the client. The correct answer is 2. Because the client is experiencing difficulty processing and completing complex tasks, the priority is to provide the client with only one step at a time, thereby breaking the task up into simple steps, ones that the client can process. Repeating the directions until the client follows them or demonstrating how to do the task is still too overwhelming to the client because of the multiple steps involved. Although maintaining structure and routine is important, it is unrelated to task completion. A nurse and a nursing assistant are caring for clients in a labor and birth unit. Which task should the nurse assign to the nursing assistant? 1. Perform a fundal check on a 2-day postpartum client. 2. Remove a fetal monitor and assist a client to the bathroom. 3. Give ibuprofen 800 milligrams by mouth to a newly postpartum client. 4. Teach a new mother how to bottle feed her infant. The correct answer is 2. Removing a fetal monitor from a client and assisting her to the bathroom are within the realm of practice of a nursing assistant. Performing a fundal check is an assessment, which is a responsibility of a nurse. A nursing assistant is not permitted to administer medication by any route. Education is also part of the professional nursing role. Although a nursing assistant can assist a mother with bottle feeding, the formal client education must be completed and validated by the nurse. When assessing the frequency of contractions of a multiparous client in active labor admitted to the birthing area, the nurse should assess the interval between which of the following. 1. Acme of one contraction to the beginning of the next contraction. 2. Beginning of one contraction to the end of the next contraction. 3. End of one contraction to the end of the next contraction. 4. Beginning of one contraction to the beginning of the next contraction. The correct answer is 4. To assess the frequency of the client's contractions, the nurse should assess the interval from beginning of one contraction to the beginning of the next contraction. The duration of contraction is the interval between the beginning and the end of a contraction. The acme identifies the peak of a contraction. Which of the following would alert the nurse to suspect that a child with severe gastroenteritis who has been receiving intravenous therapy for the past several hours may be developing circulatory overload? 1. A drop in blood pressure. 2. Change to slow, deep respirations. 3. Auscultation of moist crackles. 4. Marked increase in urine output. The correct answer is 3. An early sign of circulatory overload is moist rales or crackles heard when auscultating over the chest wall. Elevated blood pressure, engorged neck veins, a wide variation between fluid intake and output, with a higher intake and output, shortness of breath, increased respiratory rate, dyspnea, and cyanosis occur later. When developing the preoperative plan of care for an infant with Hirschsprung's disease, which of the following should the nurse include? 1. Administering a tap water enema. 2. Inserting a gastrostomy tube. 3. Restricting oral intake to clear liquids. 4. Using povidone iodine solution to prepare the perineum. The correct answer is 3. Before intestinal surgery, dietary intake is limited to clear liquids for 24 to 48 hours. A clear liquid diet meets the child's fluid needs and avoids the formation of fecal material in the intestine. Typically, repeated saline enemas, not tap water enemas, are given to empty the bowel. Soap suds enemas are contraindicated for infants, as are tap water enemas. A nasogastric tube may be inserted for gastric decompression. Insertion of a gastrostomy tube is outside the scope of nursing practice. Because the perineal area is not involved in the surgery, it does not need to be prepared. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After a subdural gastrectomy, the nurse is developing a plan with the client to assist the client to gain weight. To help the client meet nutritional goals at home, the nurse should 1. Instruct the client to increase the amount eaten at each meal. 2. Encourage the client to eat smaller amounts more frequently. 3. Explain that if vomiting occurs after meal, nothing more should be eaten that day. 4. Inform the client that bland foods are typically less nutritional and should be used minimally. The correct answer is 2. Because of the client's reduced stomach capacity, frequent small feedings are recommended. Early satiety can result, and large quantities of food are not well tolerated. Each client should progress at his or her own pace, gradually increasing the amount of food eaten. The goal is 3 meals daily if possible, but this can take 6 months or longer to achieve. Nausea can be episodic and can result from eating too fast or eating too much at one time. Eating less and eating more slowly, rather than not eating at all, can be a solution. Bland foods are recommended as starting foods because they are easily digested and are less irritating to the healing mucosa. Bland foods are not less nutritional. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2, 4, and 5. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. When developing a teaching plan for the community about managed care models and their effect on clients with chronic mental illnesses, which of the following factors should the nurse include as detrimental to this population? Select all that apply. 1. Restriction in the range and quantity of services. 2. Hospitalization reserved for emergency services. 3. Non-shifting of funding to outpatient services when clients are moved to these services. 4. Loss of the principle of least restrictive alternative for care. 5. Lack of sufficient numbers of group homes and supervised apartments. The correct answers are 1 and 3. Without a sufficient range and quantity of services, care is inadequate and hospitalization rates increase. Non-shifting of allocated funding to outpatient services has increased the problem with the range and quantity of services. Reserving hospitalization for emergency services was a practice before managed care. The principle of least restrictive alternative is still as relevant as it was before managed care. There are not enough group homes available. A client with early dementia exhibits disturbances in her mental awareness and orientation to reality. The nurse should expect to assess a loss of ability in which of the following other areas? 1. Speech. 2. Judgment. 3. Endurance. 4. Balance. The correct answer is 2. Clients with chronic cognitive disorders experience defects in memory orientation and intellectual functions, such as judgment and discrimination. Loss of other abilities, such as speech, endurance, and balance, is less typical. A full-term client is admitted for an induction of labor. The healthcare provider has assigned a Bishop score of 10. Which drug would the nurse anticipate administering to this client? 1. Oxytocin 30 units in 500 milliliters D5W. 2. Prostaglandin gel 0.5 milligrams. 3. Misoprostol 50 micrograms PO. 4. Dinoprostone 10 milligrams. The correct answer is 1. A Bishop score evaluates cervical readiness for labor based on 5 factors: cervical softness, cervical effacement, dilation, fetal position, and station. A Bishop score of 5 or greater in a multipara, or a score of 8 or greater in a primipara indicate that a vaginal birth is likely to result from the induction process. The nurse should expect that labor will be induced using oxytocin because the Bishop score indicates that the client is 60% to 70% effaced, 3 to 4 centimeters dilated, and in an anterior position. The cervix is soft and the presenting part is at a -1 to 0 position. Prostaglandin gel, misoprostol, and dinoprostone are all cervical ripening agents, and the doses are accurate. However, cervical ripening has already taken place. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.